in this morning's Healthy Woman Report, this is sort of a moment of truth. We're going to talk about which non-surgical facelift works best. Earlier this summer, we met identical twin sisters. They were about to try different kinds of non-surgical facelifts that don't involve scalpels, stitches, or scars. The twins just had their final treatment yesterday, and they gave us a video diary.
I'm Kathy. And I'm Karen. And we're the Ritter twins.
We first met Karen and Kathy back in July. The girls have always been inseparable, and since they were little girls, have done everything from brownies to babysitting together. Even in their 40s, they're raising their families in the same small town. And now they've embarked on a new journey, turning back the clock and turning it back together.
Thank you. I would like to look as healthy as I feel.
Karen? I have great expectations.
For a month and a half, the twins let Good Morning America come along as they traveled back and forth from their homes in Florida to New York to try two separate cutting-edge technologies that they hope will erase the lines of time. These new cosmetic procedures forego the scalpel, scars, and long recovery time of invasive plastic surgery and use lasers in short, outpatient, lunchtime visits. Kathy's first visit kicks off the process by applying numbing cream to her face so she won't feel the sting of lasers. The procedure is a form of combination rejuvenation therapy. Dr. Michelle Copeland begins with microdermabrasion, which sandblasts the skin, exfoliating the top layer of dead cells. Next, black carbon cream is applied that guides the laser that will work to stimulate collagen and tighten the remaining layers of skin. Then, finally, comes recovery.
Your face feels like a sunburn.
But not for long. Kathy had to return 3 more times every 2 weeks for follow-up treatments. For her twin sister, Karen, Dr. Howard Sobel takes a slightly different approach with Cool Touch technology. Numbing cream and Valium are the first order of business for Karen. Next, Dr. Sobel uses the Aurora laser to target brown spots and sun damage.
What was it like?
A hot camera
A hot camera flash, okay? So this is just working on those little dark spots that you complained about.
Afterwards, the Cool Touch laser stimulates old cells to make new collagen, filling out wrinkle lines and scars. Like her twin, Karen also underwent 4 treatments. The result? Temporary dots where the laser did its job.
You remember the design lady that said polka dots are in New York?
Joining us are our identical twins, Kathy Fitch and Karen Cascadden. We're also joined by their doctors. Dr. Howard Sobel used what is called the Cool Touch laser on Karen, and Dr. Michelle Copeland, who has written a book on this topic, and she's using what we call a rejuvenation combination technique with Kathy, and I appreciate all of you being here. So Kathy, look at Karen. Does she look different to you?
Extremely different.
Extremely different. And
Yes.
You're pleased with her results?
Oh, I am.
Okay, Karen, you look at Kathy. Does she look different to you?
She's greatly improved.
Greatly improved?
Yes,
Okay, so you're pleased with the results?
I am.
All right, let's start with Kathy. Let's do the before of Kathy. Can we get that up? They're working on it. Okay, there's the before and the after. All right, and Karen, the before. All right, let's get the before on Karen. There's the before on Karen and the after. All right, now, I'm not sure, Dr. Copeland, that everybody could follow all the specifics of those details of what you actually do with the different techniques, so I don't want to get into such detail with these, but the key is no surgery, and is it just skin that you change, or do you change other things?
Well, today we have new technology that can allow us not only to smooth the skin, get rid of some of the scars, and she had a little area of irregularity here, but also tighten below the skin so that we can stimulate collagen. And by doing that with these light touch techniques, we can get a tightening effect.
Did I see a slightly is chin on her, or is it just my imagination?
Very good. You saw some tightening along the jawline and also a little bit of tightening underneath here. And in the cheek area as well. So it smooths the skin, getting rid of irregularities, but also tightens.
Okay, because it does change. It almost looks like it changes the line of the chin a little bit by that tightening that you're talking
Yes,
about.
that's right. The line over here, the jowls that start to form, it tightens that area.
Okay, and how about with you? What specific changes did you see in Karen?
Well, it's important to know that, nothing takes the place of a true facelift if the person has totally lost elasticity in their skin.
Right.
What the Cool Touch or the Aurora is for, it's for people in that in-between stage, and that's what Karen is. Okay, she lost some elasticity in her skin. She had fine little lines around her eyes. She had little dilated little blood vessels on her face. She had some little freckles she was concerned about. So we used 2 different types of lasers to get rid of that.
So I hear you saying, though, that it can't do everything that traditional facelifts can do.
Well, when you reach a point where you're 50, 60, even 70 years of age and the skin is hanging, you need to cut that skin and pull it back. But medicine and surgery is now going to the non-invasive. People want to go back to work. They rather have several non-invasive surgeries where they could go back to work and have no downtime.
Does it last as long?
What it does is it not only makes the skin look better, but it makes it healthier. It's what I call cosmetic wellness. So that if people start earlier, it may be possible never to need that facelift. And that's the beauty of these techniques. There are little steps that you can do without any downtime.
Will Karen, though, have to come back for treatments? Or is she done?
I don't think there's anything in terms of aging where you're really done. You're constantly, from the day you're born, you're aging. So I think we've improved her. And I think in a year from now or 2 years from now, we'll do some maintenance therapy on her. And I promised both the twins, maybe I cheated on that and telling them that I would do some Botox later on them because I wasn't allowed to do that for this session.
Right.
So
we wanted a pure test here for this. Cost?
Well, these procedures cost several $100s, so it's easy to sort of jump in and do something to make yourself look better without spending thousands of dollars.
Each treatment costs several hundred? How many? What's several hundred mean?
Well, they can vary anywhere from a few $100s to, say, $700 or $800.
Per treatment?
Yes.
So over 4 treatments, so you're talking about roughly $2,000 to $3,000.
That's right, yes. But it's something you can spread out over time.
And both techniques cost about the same?
pretty much, yeah.
Okay. Pleased?
Very pleased.
Scale of 10?
10. 11.
Hey, watch that.
All right. Well, she just had to go second, so she had to top Karen. Okay, thanks. Good to have all of you here.